Hello, my name is Dr. Greg Ruff. I'm a plastic surgeon. I taught at Duke for 16 years prior to starting my private practice here in Chapel Hill. I've lived in this area for 33 years, having grown up in Michigan. And we're going to talk today about one of the operations that's most popular with my patients. The reason the standard face and neck lift has an incision from the front of the ear back into the scalp is because the direction of lift is generally parallel with the jawline. So the cheek is tightened by removing skin in front of the ear, and the neck is tightened by removing skin behind the ear. That direction of lift has a little vertical component, but a lot of horizontal component. I don't think we age in a horizontal fashion. We age vertically. So when I do a microlift and anchor the suture up here and come down toward the jowl, that's a very much more natural type of lift. The microlift is less invasive, takes less time, is less painful, fewer complications, less expensive. We usually do this with local anesthesia and some oral sedation. When I do a microlift and lift the skin up in front of the ear, the skin is still attached down near the mouth, in the jowl area, the nasolabial fold, neck. And so the barbed suture is placed up in the temple, under the skin, and exits down in the jowl area. And then hold the sutures again and slide everything up. So the skin can be made every bit as tight as a facelift without the invasiveness, without the cost and the time involved. Now, microlifts are also done in a different way by other surgeons. They don't use the barbed suture like I do. They will lift up the skin in front of the ear to the same extent I do, and then instead of putting the barbed suture in, they will put in what's called a purse string suture. That's anchored up near the temple here, usually right at the base of the ear, and then it comes down in a teardrop shape and back up again. When the suture's tied, it pulls the tissue up, and you might think this is very much like the barbed suture can do. There's a big difference, however. With a purse string suture, as you pull it tight, it's just like a Venetian blind, and the blinds start to stack up at the bottom. So you're pulling this tissue, and it's gathering at the bottom of the purse string. What's more, the purse string sort of makes a little donut shape under the skin that needs to be smoothed out. The barbed suture, in contrast, since it's put in this upside down U shape, allows the tissue to always go up to the top where it's anchored in the muscle on the side of the head. So it will shift the tissues higher than the purse string suture. It will do it in a gradual fashion without creating a donut. Is faster, and because you're pulling it up even higher, more effective at lifting the face. The big improvement has been to extend the incision a little bit into the scalp and lift up the scalp in the temple. Very safe, very easy to do. And then when I pull up on the cheek, those barbs are engaging the side of the cheek and the scalp and pulling up all the way to where it's anchored, actually tightening the crow's foot area. So we haven't done an analysis of our last 100 cases using this modification, but I think it's going to have an even higher satisfaction rate than the 92% we had originally. An initial consultation usually takes about an hour. We schedule lightly. I want to make sure all your questions are answered, and I want to make sure that you understand what options you have. Sometimes things don't require surgery. Sometimes the operation is exactly what you expected, and sometimes you'll end up deciding to do something even more extensive. But I want to make sure that we set your expectations and make them realistic. So if you'd like to pursue rejuvenation of your face, reverse those aging changes that have accumulated over the years, contact our office, either by phone or on our website, gregruffmd.com.